In the second part, we'll talk about the lines of treatment of diabetes. We discuss the different groups of anti-diabetic agents in brief, and we'll talk about types of insulin and insulin regime, and eventually I'll give you the guidelines for treatment of type 2 diabetes according to the ADA guidelines. The aim of treatment is not only to keep the patient asymptomatic. As we said, the main symptom of diabetes is polyuria. When polyuria occurs? And what is the underlying pathophysiology of polyuria? Why polyuria occurs in diabetic patient? Glucose. When it occurs in urine? Glucose, when it starts to occur in the urine? How normally glucose filtrated by glomeruli or not? Normally. By glomeruli. You normally complete. But almost all filtrated glucose is reabsorbed, for no problem. But in diabetes, because of increased level of glucosuria, the sum of glucose exceeds the reabsorptive capacity of the kidney, so we'll get glycosuria. When it starts glycosuria, at which level we start to get glycosuria? Usually above 180, but there is wide individual variation, and that is the underlying cause of asymptomatic course in some patients, because some patients remain free of glucose in urine even up to 200 or 250. When glycosuria starts to develop in urine, it will act as osmotic and lead to polyuria. So if the patient has polyuria, blood sugar monitor count 350, and we bring the blood sugar from 300 to 150, from 350, the patient becomes asymptomatic. But is it enough for the treatment of this patient? Of course, no. The patient will develop complications in the future because still he has not reached euglycemic status. So keeping the patient symptom-free is not enough. Our aim is to keep the patient symptom-free and to prevent microvascular and macrovascular complications, in a major cause of morbidity and mortality in diabetic patients, by achieving the target control of diabetes. Now, what are the lines of treatment of diabetes? What are the lines? First line هو lifestyle, as we said, the major factor اللي هي include يعني diet and exercise. And second line هو anti-diabetic agent or anti-hyperglycemic agent. In addition to that, diabetic patient needs psychological support, because telling the patient you have diabetes might be a shock for some person, according to the personality. Some patients start to cry in the clinic when you tell them you have diabetes, or the family of the child start to cry when you tell them your child is diabetic. So you have to support the patient and the family by reassuring them that in spite that although this is long-term disease, although it's associated with morbidity and mortality, and which is well known for the lay people, but still the disease can be controlled and you can enjoy your life, and there with some modification in diet and some treatment. This support will make the patient compliant with the treatment. Otherwise, patient escape treatment. يقولون بعد ما أخذ يروح some other herbal therapy or some other illegal treatment, and keep the patient in contact with you. If he trusts you, he will continue further up with you to reach the glycemic control. So psychological support is very important part in the management of the patient, especially in the first meeting with the patient. Another important point in the management of diabetic patient is education. Health education is important for any disease, but in particular for diabetes, you need a lot of talk with the patient and with each visit, because you need to educate the patient about the natural history of diabetes, about the diet of the diabetes, exercise, benefit of exercise, use of treatment, use of insulin, symptom of hypoglycemia. All these points you have to clarify them to the patient so he can meet with the management of diabetes. A few words about dietary instruction for diabetic patient. Regarding carbohydrate, advise the patient to avoid simple sugar because of rapid absorption and peak postprandial hypoglycemia, and encourage use of complicated sugar like starch, like in rice, spaghetti, bread, and limited amount, of course, to avoid rapid rise in glucose level after meal. Avoid saturated fat because of increased risk of hyperlipidemia in diabetic patients, especially hypertriglyceridemia, and encourage consumption of polyunsaturated fat. Allow protein intake in the range of 1 gram per kg. Vegetables are freely allowed for diabetic patients because of fiber content and lack of carbohydrates. Fruits are allowed with 1 or 2 pieces per day, different type. Regarding diabetic food and sweeteners, many diabetic patients ask us about the health risk of this drug. There is controversy about the safety of this drug, but in general they are accepted in limited amount, except in pregnancy and lactation. These are the general instructions for diet. Now come to anti-diabetic patient. We have large number of anti-diabetic agents, and every year we hear about a new drug because of pandemic problem, because big health problem of diabetes. So many drug companies working and spend millions for discovery of new drugs. And I try to simplify them for you in different groups, and you have to remember 1 or 2 members of each group is enough for you at this level. First group is insulin secretases. From this name, this group act by stimulation of beta cell to secrete insulin, like sulfonylurea and ripaglinide. Second group, insulin sensitizer, and it's clear from the name, they sensitize the peripheral tissue for the insulin, which is the main problem in type 2, they have insulin resistance. Important member in this group هو metformin والبioglitazone, the only member of thiazolidine diones. Third group is incretin-based therapy. We talk about incretin, and in this group, the drug either inhibit DPP-4 to potentiate the effect of incretin, or act like GLP mimetic. Act on the receptor to mimic the GLP action. The fourth group is amylin analog, which is of limited use, and alpha glucosidase inhibitor, a carbose which inhibits splitting of carbohydrate in the intestine to limited absorption, also of limited use. And the most recent group هو ال SGLT2 inhibitor, like canagliflozin. And lastly, insulin. Few words about each group. Sulfonylurea, as we said, the traditional treatment for many years. Most important member who are a glibenclamide, which is the old generation of sulfonylurea, and the recent generation were a glimepiride or emerin. A traditional name, you have to know their name from to help you in the classifying the treatment in the history. يعني أحيانا patient not bring the drug with him فتقول له ايش تاخذ تريتمنت يقول لك اخذ دواء قبرصي مثلا فلازم تعرف على التراديشنال حتى تعرف شنو البيشنت يقول مثلا الداونيل يسموه القبرصي الجليمبرايد يسموه حبايه الزرقاء او خضراء اكو 4 ملغ و 2 ملغ فيقول لك اخذ حبايه الزرقاء الصبح معناه هذا اميريل جليمبرايد 4 ملغ او الخضراء 2 ملغ. The action of sulfonylurea as we said by stimulation of beta cell to secrete insulin. The main side effect they are anti-diabetic agent. So main side effect هو hypoglycemia. But another problem with each diabetic agent, which consider one of the preferable points in the use of this drug, هو effect of this drug on weight. Because as we said, an increasing weight means more insulin resistant, more glucose impairment. Sulfonylurea one of the well-known drug that increase body weight. Okay? Remember that. Second member of insulin secretase هو الريباجلينايد. Repaglinide just like sulfonylurea, action, side effect. One advantage in it is metabolized by the liver. So it is, to some extent it can be safely prescribed in patients with renal failure, renal impairment because of hepatic metabolism. Third drugs هو metformin أو اسمه شنو يسموه glucophage. Traditionally البيشنت شو يسموه مساعد. Metformin or glucophage act by increase insulin increase the response of peripheral tissue to insulin. So it is insulin sensitizer. The side effect limited side effect, but the main side effect هو metallic taste يعني في abnormal taste يصير GI upset and rarely هو lactic acidosis and B12 deficiency because of impairment of interference with the B12 absorption. Regarding the effect on body weight, glucophage at least maintain body weight and it might reduce body weight in some patients. It might reduce body weight in some patients. Fourth one هو pioglitazone أو Actos trade name. Action it is also insulin sensitizer. Side effect هو regarding the body weight it increase body weight. But other side effects which are specific for pioglitazone هو increased risk of leg edema, heart failure, and increased risk of bone fracture. That's why it must not be used in patients with violent sport like football player because of increased risk of bone fracture. Incretin-based therapy. We have two groups, either enzyme inhibitor or incretin or GLP receptor agonist. Incretin mimics. A DP4 inhibitor acts by inhibition of DP4 enzyme. That's why it prolongs, potentiates the action of naturally secreting incretin GLP. Example of DPP4 inhibitor هو عندنا sitagliptin جونيفيا أو vildagliptin الجالفاس اسمه التجاري. الميكانيزم as we said by inhibition of the enzyme. Side effect very limited side effect tolerated by many patients. Effect on weight it has no increased risk of body weight maintain body weight. فصار عندنا ميتفورمين والدي بي 4 maintain body weight بينما السلفونيوريا والبايغليتازون increase body weight. GLP agonist like liraglutide, this drug mimic GLP in their action, but disadvantage or consider يعني good drugs associated with reduction in body weight and it also might increase has cardioprotective effect. But the disadvantage of this drug هو subcutaneous use, cannot given orally. Although nowadays ACU preparation can be given once weekly, ACU new يعني drug in the trial اللي هو which can be given orally من ال GLP، لكن اللي available now هو given subcutaneous either daily or on weekly basis. بس هنا الإفكت مالته إنه cause weight loss. And now consider one of the treatment of obesity هو ال GLP agonist, even non-diabetic patient. The most recent group هو SGLT2 inhibitor. As we said, glucose almost filtrated freely by glomeruli, but almost all filtrated glucose is reabsorbed by the renal tubules. So normally we have no glucose in the urine. And about 90% of glucose is reabsorbed in the proximal tubules by together with sodium by a certain carrier protein called SGLT, يعني sodium glucose co-transporter, certain protein which carry glucose from the fluid, from tubular fluid to the blood. So this group of a drug, SGLT2 inhibitor, inhibit this protein. So the net result will be excess glucose in the urine, and then the excess glucose will be discarded with the urine. So of course, with time you will get rid of glucose, excessive glucose, and you achieve the euglycemic state. In addition to that, if you get rid of excessive glucose, mean you get rid of excess calories, this mean what? إذا limited calorie intake شو راح يصير عندك؟ Body weight or weight loss. That's why they found in this drug cause also significant reduction in the body weight, in addition to the euglycemic state. In addition to that, by inhibition of glucose, because of combined effect of this receptor for glucose and sodium, if we inhibit that, there will be excess sodium excretion in the urine. So what that mean? معنى blood pressure راح يصير بيه. It will reduce blood pressure. So another advantage of this drug is reduction in the blood pressure. And by not exactly known mechanism, probably by neuroendocrine effect, they found the GLP important in the treatment of heart failure because of increased excretion of glucose and because of other factor. And now has been labeled as anti-failure drug. يعني نعرف شنو anti-failure drug for heart failure. For example, diuretic مثلا مو الARB AC inhibitor. Now SGLT2 inhibitor recently considered one of anti-failure treatment for heart failure because of their effect on heart failure. Example of this group عندنا canagliflozin and dapagliflozin and other member canagliflozin Vocana or dapagliflozin Farxiga. Action we talk about that. Side effect because of excessive glucose in urine, this will increase risk of urinary tract infection and genital tract infection, especially in female. So you must be aware about that when you prescribe this drug to the patient, to your patient. And the body weight, as we said, it reduces body weight. Amylin analog of limited use, you can read about it, also alpha-glucosidase. So in summary, regarding the effect of anti-diabetic on body weight, some drug associated with weight gain اللي هي sulfonylureas and pioglitazone, thiazolidinedione. Some drug maintain body weight like metformin and DPP-4 inhibitors, and other drugs reduce body weight, cause significant weight reduction اللي هي GLP-1 agonist and SGLT2 inhibitors. Clear now? Anti-diabetic agent. هم صار confusion عندكم؟ واضح إن شاء الله. يعني عندنا insulin sensitizer, insulin secretase, وعندنا DPP-4 incretin based therapy, والSGLT2 inhibitor هي the most important drug. Any question? Okay. Now come to insulin. What is the source of insulin? From where we get insulin? The يعني traditional insulin. Yes. Anybody? نعم. لا يعني شلون ياخذ من بيتا from the humans؟ يعني هذا موجود بالفارماسي هذا in the market insulin from yes شو يسموه؟ by DNA engineering أو يعني DNA technique. Initially يعني years ago the source of insulin was from the cows and from the pigs, which is associated with يعني increased risk of allergy. But for last years, now by genetic engineering or by DNA engineering, the principle of DNA engineering, they put the code of insulin in the culture media of E. coli, and E. coli start to synthesize insulin and then isolate insulin, and we get human-like insulin because the genetic code just like that of the human. But the insulin has short half-life. So to prolong the half-life, either they change the structure of the insulin or add another substance, for example, zinc or isofen insulin to prolong. So in general, we have the following types of insulin according to the duration of insulin. We have short-acting insulin, which act within 30 minutes and lasts for 3 to 6 hours. Short-acting. اللي patient call it what? صافي. من يقول لك patient آخذ صافي يعني شنو ياخذ؟ soluble insulin أو short-acting insulin. Short-acting insulin act within 30 minutes. Some patient in hurry, so they inject themselves insulin and after 5 minutes start to take their meal. And this will not give time for insulin to act. So they will get what? Postprandial hyperglycemia. So to avoid this problem, they start to synthesize the Lysipro or aspartame, so which is rapidly acting, which acts within 10 minutes. So even after 10 minutes, when you start to take meal, there will be no problem. Okay? We have intermediate insulin, which act for 6 hours, about 12 hours, 12 hours, like isofen insulin or lenti insulin, which called by the patient as خابط. إذا أقول لك آخذ خابط يعني شنو ياخذ intermediate insulin. أوكي؟ اللي هو isofen insulin. isofen اللي موجود عادة isofen. And we have the long acting insulin. هناك قلنا 12 hour. long acting معناه ايش قد؟ 24 hour. فالشورت 6 hour, intermediate 12, واللong acting 24 hour أو called basal insulin. Example عندنا glargine insulin and diglutac insulin. The advantage of this insulin is with one dose you can cover 24 hours. Second point, it is peakless. What we mean by peakless? If you see for example, the blue line, اللي هو isofen insulin, after 4 hours there will peak of insulin and then return back to the baseline after about 12 hours. During this period, you might get hypoglycemia if the patient cannot take his his meal because of peak. While long-acting or basal insulin like diglutac and ditimir, the green color, it is peakless. Remain over 24 hours, تقريبا peakless. So the risk of hypoglycemia is low, and it supplies the basal requirement over 24 hours. last type هو premix insulin, يعني هو يجينا احيانا هو mixed soluble insulin و intermediate insulin نسميه premix insulin in different percentage 30-70 او 50-50 والبيشنت call it شو يسميه المريض؟ يقول لك اخذ مزيج او مخلوط يعني بيه صافي وخابط. هذا بذاك يسموه خابط وهذا يسموه صافي. واضح؟ حتى من يقول لك المريض تشي بالهيستوري تعرف what type of insulin used by your patients. The indication for insulin therapy, as we said, type 1 is a mandatory, no other line. Type 1 must be treated by insulin. Many patients with type 2 diabetes, eventually they need insulin because of failure of beta cell. Initially قلنا اكو انسولين but with time there will be damage of beta cell, there will be no more insulin, and eventually need insulin. Or type 2 during stressful situation, مثلا surgery, infection. In this condition, there is increased risk of counter-regulatory hormone like catecholamine and glucagon. So to overcome hyperglycemia in this period, we put the patient on short course of insulin. These are the indications. Route of administration, insulin given by subcut injection or IV or IM. Okay? In the تقريبا 1 or 2 years ago, they prepare inhaler insulin, which is approved by FDA, but still of limited use because of controversy about the safety of the drug and difficulty in the adjustment of the dose. So nasal preparation is still of limited use even in the United States. Insulin regime, how we give insulin? Insulin not like any drug 1/2 or 1/3 tablet or capsule. It's injection and associated with the high risk of hypoglycemia. So in general, طبعا insulin regime أقفى statement, each patient has his own insulin regime. And you decide that by process of some trial and error. تنطي الدوز السوفرجين until يعني reach the suitable regime for that. But in general, insulin can be given once daily. When we need to use once daily regime, what type of insulin you will choose? Of course, basal insulin, long acting, to cover 24 hours. This regime used usually in type 2 diabetic patient who fail to respond to oral hypoglycemic. So you can add basal insulin in addition to anti-diabetic agent. Which type يعني we continue with insulin؟ إذا metformin. ليش مستلفون يوري؟ هو مو اساسا هو هايبرغلايسيميا، احنا we want to reduce the glucose level. يعني ممكن هم weight gain اوكي، بس هو احنا يعني يس لا احنا why we need insulin because we reach a state of responsiveness of the beta cell, صار complete damage of the beta cell. فin this case sulfonylurea become of no value. It will stimulate what? Stimulate dead cell. That's why you have to stop sulfonylurea, but you can continue with insulin sensitizer like metformin or pioglitazone. So this regime usually suitable only for type 2, not enough for type 1. The second regime هو twice daily regime. Twice daily regime معناه you would choose what type of insulin twice daily. يعني insulin which act 12 hour اللي هي which type قلنا؟ which type? Short or intermediate or long? Intermediate. Intermediate insulin which act 24. فإذا we use intermediate insulin twice daily to cover 24 hour. But intermediate insulin يعني اللي قلنا مثلا like azofin, the onset of action is about 4 hours. So during this period you need some sort of insulin which acts immediately. So we must do what? Short acting. So in twice daily regime we use combination of short acting and intermediate acting. Short acting for immediate effect, will intermediate for next 12 hours. Okay, and that's why in this regime we better to use what? حتى بريمكس انسولين نقولها الانسولين المزيج mixed insulin. تقريبا كافريج 2/3 of the total dose given in the morning and 1/3 of the dose given at the night. This regime is suitable for many patients with type 1 diabetes, but it's not optimal. The optimal regime is the basal bolus regime. Basal bolus regime mean we use basal insulin to cover the basal requirement of insulin, which occur over 24 hours. But this, though, as we see in the curve, the level of basal insulin not reach the high level, basal level. After meal, you will get hyperglycemia and cannot be controlled by basal insulin alone. You need what extra dose of bolus insulin أو short acting insulin. فin this regime we use basal insulin once daily, can be given at morning or at evening, no problem, because it's for 24. Plus bolus insulin of soluble insulin before each meal to cover postprandial hypoglycemia. But some patients might need it twice daily, يعني not necessarily three times daily basal bolus insulin. لأن قسم خصوصا outside they take 2 meals per day. مثل 3 وجبات يوم وجبتين. You give them twice daily soluble insulin plus basal insulin. This regime consider the optimum regime for insulin because it mimics the normal physiological state in the body. اللي احنا عندنا always fed basal level of insulin with peak after each meal. But on other hand, this regime need highly compliant patient. لأنه you will give him 4 doses of insulin. 4 doses. احنا patient 1 injection per day, and difficult to satisfy the patient to accept this idea. How you can satisfy the patient to use 4 daily doses? Second point, you need educated patient لأن هذا يحتاج إنه هو فد stable fixed diet regime. مو مثل يوم يتغدى بال12 يوم يتغدى بال4 وهذا، لأن هذا راح يصير ممكن هايبوغلايسيميا. اني ديلي بالميل ممكن يصير عنده هايبوغلايسيميا، فيحتاج educated and highly compliant patient. last insulin regime هو by using of artificial pump أو between 2 brackets called artificial pancreas. Why? أو closed loop يسموه. Why it called artificial pancreas? Because this electronic machine, it has composed of 3 components. First is insulin sensitizer, glucose sensitizer, which measure glucose level in the interstitial tissue, not in the blood, by stick attached to the skin أو needle. هذا مثلا هنا أكو wireless sensitizer، هذا هنا أكو إحنا previously أكو needle implanted to subcontinent which measure glucose level over 24 hours. This sensor gives signals to the second part of the system اللي هو insulin pump to give him an idea about the level of glucose. The third part هو implanted needle in the skin which deliver insulin to subcutaneous tissue. And you have to set this electronic pump according to the lifestyle of the patient, according to the blood sugar profile. مثلا فرضا 0.1 unit per hour فرضا per kg per hour, and increase the rate or decrease the rate according to the activity of the patient, according to the diet. This system apparently considered يعني ideal solution for diabetic patient, but in fact in practice there are many problems, including the cost. It costs about $2,000, $2,000 to $3,000. Maintenance, هذا السensitizer هذا implanted needle need to change every 1 to 2 weeks, which costs about $500. This machine, like any electronic machine, like your mobile, your iPad, it's susceptible for error or for problem. So this problem might lead to hypoglycemia or hyperglycemia. And reported the cases of hypoglycemia in school student in United Kingdom, and they put insulin pump. They blame the company why this system not give alarm to our children about the hypoglycemia. Error is present. That's why it remain of limited use, like it is a step in the horizon of the treatment of diabetes. Side effect of insulin, main side effect of hypoglycemia, weight gain. It might affect the lipid, lead to hypertrophy or lipid dystrophy at the site of injection. Last point, general instruction about the use of insulin. You have to know them to learn your patient. Unless you don't know, them, you can't learn your patient about this instruction, which are important to the management of diabetes. First, store of insulin. You have to store it in the refrigerator not in the freeze, because when it freeze, you have to discard it because it will damage. And many patients, especially in the summer, they keep it in the freeze to avoid يعني damage of the insulin. فمن يصير freezing يرجعون يذوبوا ويستعملوا هذا. This is wrong. Second point, the patient must know the syringe. Do you know what is the capacity of insulin syringe? Anybody know? 1 cc. يعني كل السرنجة 1 cc. When you ask your patient how much you take insulin, يقول لك آخذ 20 cc الصبح و10 cc بالليل. هو قصده 20 فيها تلنيان البيشنت يعني قلت وحدات هذه يعني يجوز يشتبه يروح ياخذ سرنجة عادية يسحب سي سؤال. فيو هاف تو لين البيشنت. الانسولين السرنج كومبوز اوف 10 بارت 10 كومبارتمنت مثل ما تلاحظون مقسمه الى 10 20 30 40 لان كل كومبارتمنت اللي هو 0.1 مل which contain 10 unit لانه concentration system of insulin in our country like the American system اللي هو 100 per ml يعني كل ml of insulin contain 100 unit while the European system هو 40 ml يعني كل ml ب 40 unit. فالcalibration of their syringe differ from our syringe. اوكي فيجوز يجي واحد يجيك من فرنسا from United Kingdom يجيب السرنجات مالته يستعمل الانسولين مالتنا راح يصير عنده ايرور بالدوز هذا. So you have to learn your patient. Nowadays insulin syringe is replaced by insulin pen اللي هو فد device composed of cartridge which contain the insulin about 300 of insulin and the needle placed in the end of the pen and a knob for calibration. In this calibration we find this number. So when you instruct the patient to take 20 units at morning and 10 units at evening. Some patients find difficulty in adjustment of the dose, especially old people with poor vision. But with this pen, you can give the exact dose because the pen will deliver the dose. The patient adjusts the pen on 20 unit and then inject himself by pressing the knob, red knob, and the pen will deliver 20 unit. ويتوقف هذا. Okay? But أيضا you have to read about the use, no time to talk about it, to read about the use of pen, أكفد instruction how to use it, to learn your patient. You have to read it. Site of injection. One of the problem in our patient who always use the right arm because it is easy for him. Inject left arm, sorry, inject himself. With time, he will use insulin for life. With time, they will get damage to the tissue and fibrosis. The injection become painful and the absorption of insulin will be poor because subcutaneous tissue replaced by fibrous tissue which lack adequate blood vessels. So you have to learn the patient, again back to education, and to use rotation technique. يعني one day in the right arm, one day in left arm, in the left side of the abdomen, right side, left side, in the thigh, right thigh, left thigh. So he returned to the initial site after 5 days. And this will give time for healing of the injection site. And this might be responsible for poor control of diabetes. أحيانا injection هنا fibrous tissue فما يصير absorption. بس يغير technique of injection. Sure. Third point, other point, technique of injection أيضا important, not only site. And many people use to inject themselves intradermally, while the correct way to inject insulin where subcutaneous. Intradermally, there will be no blood vessels. There will be no absorption of glucose, of insulin. So they will get poor control. So you have to instruct them about the proper use of insulin. And one of the clue for poor technique of insulin injection, patients say, I have bullous after injection of myself. Elevation. This mean what? mean intradermal injection. المفروض أصبح مثلا عندها. فإذا أقول لك ينفخ مكان الضربة مالتي, this mean wrong technique of injection. ويعني الميثود إنه you can read it, إنه take fold of skin 45 degree, you have to read it. And the last slide about the guideline of treatment of diabetic patient. Any question about insulin? Any question about insulin? Okay. Guideline. Anybody might ask, yeah, you talk about, yes.
There's a bolus regime.
Yes. Yes, for type 1. type 2 usually don't need that يعني one dose or twice dose, you know. There are many drugs of أو كل drug be advantage or disadvantage. Now how can I choose the proper drug for proper patient? Okay, we have a guideline for any disease. We have guideline according to certain association. For this guideline is put by ADA, from ADA, American Diabetic Association, the biggest association for research and for study of diabetes. According to this guideline, the first line in treatment of type 2 diabetic patient هو monotherapy. يعني use one drug, this drug is metformin. Metformin considered the first line. طبعا plus what? Plus lifestyle modification. Now, if the patient cannot control with optimum dose and adequate duration, يعني هم they recommend 3 months of metformin. احنا practical بصراحة يعني our patient not has no patient to wait 3 months. Anyway, after نقول weeks, if the patient is still uncontrolled with maximum dose of metformin about 2 grams, then you have to shift to the second step اللي هي double therapy. يعني شنو؟ 2 drugs. Which drug? Number 1 هو still metformin. Number 2 بعد thiazolidine that. Yes, what else? DP4, SGLT. Okay, so all of you are right. Second line شاف يعني when we study this drug, when compare, there is no one is superior to other. Each one has advantage and disadvantage. So you can choose any one of these drugs. We talk about them: sulfonylurea, pioglitazone, DP4 inhibitor, SGLT2, even insulin. You can, and the choice of one of these depend on your negotiation with the patient. لأنه other comorbid condition, الcost, financial stress مهمة. يعني أكو مريض مثل ال SGLT2 الcost مالته about مثلا 40,000. not every patient can pay 40,000 or 50,000 per month for this drug. You have to prescribe drug which is affordable for this patient. So by negotiation between you and your patient, you can choose the second drug. If the patient is still uncontrolled, we use 2 drugs, the patient is still uncontrolled. The third step is use 3 drugs, triple therapy. Number 1 يبقى الميتفورمين. طبعا unless there is contraindication for metformin, مثل patient under renal failure, أو some patient, minority of patient cannot tolerate metformin. يقول لك صار في severe GIT upset, you have to stop metformin. احنا ده in general patient. In the third step we use number drug هو metformin. The other 2 drugs, even any 2 of these drugs can be used. Okay. Some authors suggest to start from the second step from the beginning. If the patient has hemoglobin A1C more than 10 or more than 9, it is advisable from the beginning to use 2 drugs. From the beginning, start with the second step because they found these 2 drugs have more synergistic effect, more effective in the treatment of such diabetes of such patient. But in recent guideline, because of the finding of cardioprotective effect of GLP agonist and SGLT2 inhibitor, and again, the second line depends on negotiation between you and the patient. But according to the recent guideline, if the patient has cardiovascular disease, metformin remain first line, like in second line must be what? SGLT2 inhibitor because it has cardioprotective effect. Okay? And thank you. You have to read about these questions and answer. You become exhausted. بس إن شاء الله clear lectures. Any question?